I once had an ex that told me if I ever got pregnant, I wasn't going to keep the baby. That was very honest of him because it made me realize that I had to take certain decisions for myself. Today we're going to be preventing pregnancy without the use of contemporary forms of contraception like medications and devices like IUDs. In order for you to know how to use this method, there are 4 things that you need to be aware of. Number 1, your menstrual cycle. Number 2, your ovulation day. Number 3, your safe period. And number 4, your fertile period. Your menstrual cycle is from the first day your period starts to the first day your next period starts. And this usually ranges between 21 to 35 days. Typically, it's regular in a woman. So it can be every 28 days, 24 days, 25 days, 30 days. Ovulation is when your egg is being released from your ovaries into your fallopian tubes and they travel waiting to be fertilized by a sperm so that you can get pregnant. Now, if this does not occur, the egg typically will degenerate within 24 hours. Ovulation day is 14 days before your next period. So if you have a 28-day menstrual cycle, your ovulation day is on day 14. If you have a 30-day menstrual cycle, your ovulation day is on day 16. If you have a 26-day menstrual cycle, your ovulation day is on day 12. You cannot get pregnant without having ovulation. But one thing that you should note is that some people can have irregular menstrual cycle. And if you're one of those persons, it's very important for you to note that your ovulation days can differ. It can come on day 14, day 12, day 7. Conditions that can affect your ovulation day include ovarian disorders like polycystic ovarian syndrome, hormonal imbalances like in hyperthyroidism and hypothyroidism, and endometrial issues like in endometriosis. So please do well to combine another form of contraception if you do not want to get pregnant. A safe period are those days that you are free to have sex and not risk getting pregnant. And that's typically 7 days before your ovulation and 48 hours after your ovulation. What is your fertile period? That is the period within which if you have sex, you are very likely to get pregnant. And that is 6 days before your ovulation, on your ovulation day, and 24 hours after your ovulation. And this happens because the human male sperm lasts in the female reproductive tract for up to 6 days. And if you say, okay, I'm not going to get pregnant if I have sex 3 days before my ovulation, you'll be shocked that the sperm will just be in your reproductive tract waiting for your ovulation so that when the egg is released, it can fertilize it and you can get pregnant. So if all this is too much stress for you to handle, then you can do well to jump into one of the contemporary forms of contraception. But please do not forget that they come with their, possible side effects. So you can do either medications or devices, or you can even go surgically by doing tubal ligation, or, talk to your partner to get a vasectomy done. So you guys stay safe out there, use protection if you don't want to get pregnant, and I'm gonna see you next week Friday.